Now on the dry, how do we wet those? So I think there's two ways that you can use it, and one that could be a good use. Honey. Honey can have a double use in this one. So those ones, the dry ones, where we talk about the fillers. My brother once had a big tattoo right here in his chest, and he developed a reaction to it right on the one of the thoughts. He had kind of bad reaction to the ink or something like that. And it was very dry, and it was very itchy, it was kind of a scab and stuff. And, well, it's a good experiment. So what I did is I applied some honey on the wounds, and then I put a dressing on and to see if it would last and stuff, because that's what I had at home. And I didn't want to use my fancy dressing just when I was there. I know. I'm surprised I get Christmas gifts. But anyway, it worked. The scab went away, and it was able to kind of rehydrate the wounds. So honey works in different ways, but that would be a good one to use in that case. It's a filler as well. So when you're starting to talk about what we were talking before about aquacels and stuff, aquacel would probably be, so the dry aquacel would be this way. And when we were talking about aquacel before, when we were using the dry because there was too much moisture, would be another way that we use the cotton dressings. For the dry ones, yeah, you would use maybe some honey and things like that to kind of fill out the hole that you're filling with that. The other one that I know during the Napoleonic War they used to use it too was sugar. So if you do not have honey would be the best, but another way that you could probably try is make more like a paste. So don't dilute your sugar too much, because all you're going to have is water. But if you can make, take sugar, put some water in it and make kind of a paste, then that means you could make a little bit like a honey consistency. So more like almost like a pudding or a paste. That would help as well, the wound healing, and hopefully the dress. Now I know they used to use that in the Napoleon War. I don't know how efficient it was, because mostly when you read the literature or the past or the history of wounds, they were talking mostly about honey. But I know in the Napoleon War they were using sugar. I guess they didn't have honey or something. So that would be another one that you could use. And a lot of those wounds here, when they talk about wine and vinegar and stuff, and this is where you're getting more into infected wound. One of the problems we have with this, so like a lot of people will, well, some people will say, oh, the Roman used to use their wine to treat wounds, so then I could use my wine to treat wounds. The problem with this is that the wines that the Romans were making, and again, that's where, like, when you get stuff out of context, you're kind of losing a little bit of the information. The wine that the Romans used to use for the wounds were not high in alcohol like we have now. They were more closer to vinegar, and they were a certain kind of vinegar. So I'm not quite sure even if a vinegar would work, but it is a possibility. I mean, they talk about it in the Greece and stuff, but you're talking about increased inflammatory process that you're creating a lot of pain. I mean, you're putting vinegar in the open stuff like that, so that would be pretty bad. To make silver would be pretty hard, and again, the silver dressings that we have, so I know some people, talk about silver colloid and stuff. The problem is that the dressings that we use that have silver in it, it's a delivery system. It's a little bit when you put a patch, like a nicotine patch or a pain patch or something. It delivers the medication, because the dressing, the medication is made into a certain material that's going to release it at a certain level. So just to put nitrate on the wounds and then put it on the wound, on the dressing and then put it on the wound, is not the same thing as the dressings that you have that really slowly and stuff. The only one that really works would be honey again. So if you don't have honey and you have an infected wound and you're a little bit in a pickle, you can try those products if you want. Another one though for infection, and we're actually at this point we're talking more about necrosis. So when you have dead tissue, and I'll put a link down, is you can use maggot. We talked about it before. You can use maggot for this. Well, now where do you find your maggot? Do you take a maggot under the tree? Not really, because the ones that they use for medical purpose are sterile maggot. But I found a cool article that discuss how to create your own maggot. And again, the maggots has to be at a certain level in their evolution. So that means you cannot prepare them in advance and give them to put like some kind of like frozen maggot in your bag or something like that. They have to come in a certain way. So anyway, I'll put the article in there. That would be another option that you can use. So that would be more for the dry or the infected, wounds we're talking about. So for the puncture, what's the problem with those ones like we were talking about is that they're very deep. So at this point, a little bit like we were talking about the dry dressings, maybe honey could be used for, especially because those ones will there's more risk to get infected, and the bacteria they may use will be more anaerobic because they're so deep and they'll have more tendency. The problem too is that now to put stuff in it is very big, it's small, right? You're talking about this size versus this size. So to put a towel or something, it gets very small. So one thing you can do, if you have a towel, you could cut strips of it. The other issue too, make sure that your strips are solid, because if I put something in there and when I pull it out, it falls down, I may have a little bit of issue with that, as the material will stay inside, and now I have something that's going to either rotten or infected or create an inflammatory process, and my wound's going to get worse. So whatever you put inside a wound has to get out of the wound. So whatever you use, especially when you're starting to use improvised dressing, it has to be able to be removed 100%. So when you put things, when you do dressing, calculate what you're putting and even mark it on the chart or something, so that when you pull that out, you have and you count, and you put 5 pieces of whatever you use, you pull out 5 pieces of that stuff. Because if there's anything left in there, your wound's going to get very nasty. So for puncture wound, usually what we use, well, I was talking about before, the Aquacell kind of ribbon that we can put inside. When in the past what we have used was and still people use that stuff, but gauze ribbon. And basically the whole point of it is that basically now the wound, because the wound kind of looks like this on the side there. It's a narrow entrance, but a big holes in the side. So abscess, puncture wounds, those wounds will happen like this. So what we try to do is that, again, any space will like to be filled with liquid, so you're trying to drain that liquid out. But because it's hard to put something inside there, so what we put a ribbon, so we put sign inside. So again, if you have your towels, you could cut strips inside and put them in there and stuff. Another one that you could use is shoelace. So if you have shoelaces, if you see sometime at the dollar store or whatever, they have like the cotton laces. Well, then you could put that in and pull it out. I would take off the plastic ends of it, that makes it easier, but you could put that in. I wouldn't use paracords or stuff or things because it's more synthetic, but cotton shoelaces could be used inside. Another one that could be used, we were talking before about the use of the Foley. That means you could put that in, it would drain off well. Surgical latex tube, that could go inside and stuff, just because it's more pliable. If you have one that is more rigid, so more like what you have like on the water bladder, those ones I wouldn't put because they're too hard, and it won't do what we're trying to do, as is trying to fill out this form. So if I'm putting hard stuff, it's going to be more like going to coil on itself, but there's going to be a lot of space and it won't serve its purpose. But if you put something soft as you put it in, so as it goes in, it will fold like this, and then next thing it will take the whole shape. That's the purpose of those kind of wounds. So all those things could be ways of filling out and emptying. And one that I read one time is sometimes we use that. It's called a VAP, and basically what it is, it's dressings that you put to do suctioning, and it goes more into the wet category. But basically, you could put a sponge in there and put a compressive dressing, so like something like saran wrap could be a good way to hold it, and then you put a little tube inside, and then basically you just suck up the air out, and that would be. So if you have a sponge about that size, that means you could maybe create something like this with tubes inside. So if you have a harder tube, we got about 3 different. So we got big wounds and puncture wounds. The bigger wounds, either wet or dry. You want to keep them. If they're wet, you try to dry them. If they're dry, you try to wet them. The best way to wet them would be to use honey or a piece of sugar. If you don't have either of those, the other way that you can do it is with a wet dressing as well, what we used to call a wet to dry. The problem is that it dries very quickly, so then it becomes almost like a dry dressing. And that's why versus the honey keeps a little bit more. But if you really had to do it, I guess you could try. Well, the problem is that it's very painful. Everything gets thick and stuff. Then you got the puncture wound, which are deep wounds. With those deep wounds, you want to remove all the stuff that you have inside there. So that means that you need to create channels to irrigate those wounds. So you have to use either shoelaces or a cord of some sort. But again, no synthetic material, because those ones are not absorbent. Like if you look at like nylon, the reason we were using it for backpacks and stuff is because it repels water. For all now, if you're putting something like this in the wounds, it won't absorb. So basically you want something that absorbs it. That's why our towels are mostly with cottons and stuff. You want to absorb the liquid that you have so that you can take it out on a regular basis. And then all those wounds, if they get infected, one of the ways, the best way pretty much to use it would be to use honey again. Sugar you could try, but it's mostly more for healing, not so much for its bacterial stuff. If you had to, what they used to call the Dakin solution, and I'll put a recipe at the bottom, which basically it's just some bleach. It's a little bit of water, but again, this is for an infected wound. It's not for cleaning all the wound. It's an infected wound that you have, that you see all the signs. We talked about that before, the nerds and stones. If you have this, then you could use that, because if you use it before that, you're going to have an inflammatory process, so you're going to create an acute wound, so probably a chronic wound, and then you're going to have even more problem on your hands. So that's not the way to go. The Egyptian also were using an equivalent of penicillin, so what they were doing is a poultice of molded bread. I don't know if I would try that, but it's out there, it's been tried in the past. But also there's the maggot, if you become to a point where there's, so if you had broken your legs and you're talking about amputation and now there's necrosis in there, so there's dead tissue and stuff, and burns, that's another one that they use maggot therapy. And you can make your own, and I'll have a recipe to the bottom. So that would be the ways that they're used for infected. So anyway, hopefully that was informative. Sorry it was so long, but I hope I covered pretty much all the stuff. Again, it's improvisation, so that means like we can have 20,000 ideas. Anything is pretty good. I was trying to stick to the principle to give you a few examples of ideas so that you can come up with your own, because that's the purpose, is to look at your environment and say, what can I use in this environment to create this concept. So like in the wet, what can I use in my environment to dry what I have in the wounds there. So hopefully that was helpful, and we'll talk to you soon.